You ever wonder how we actually fight a global pandemic? You're probably picturing these, high-tech labs and futuristic gear. But the truth is, the playbook we use today, it wasn't written last year. It was written in the ink of history, forged in the fires of ancient plagues and past outbreaks. Let's dig in and see how those tragedies became our greatest teachers.
So really, how do we respond when some new disease threatens the whole world? Well, it's not just chaos. It's actually a systematic plan, a public health toolkit that's been built piece by piece, crisis by crisis, over centuries. And to really get that plan, we've got to start with the basics, just to make sure we're all speaking the same language. Okay, so it all starts on the smallest scale, with what we call an outbreak. Think of it like a spark. It's a sudden jump in cases, but it's really localized, like a bunch of people getting food poisoning from the same restaurant. It's that first crucial signal that something is wrong.
Now, if that spark isn't put out right away, it can grow into an epidemic. This is when the disease starts spreading like wildfire through a community or a whole region, way more than you'd normally expect. We've just gone from a single restaurant to maybe an entire city or state.
And when that epidemic crosses international borders and starts spreading across different continents, well, that's when it becomes a pandemic. This is the global firestorm, the kind of public health emergency that demands a worldwide response. And COVID-19 is, of course, the most powerful example we've all lived through.
So how do we even measure how bad the threat is? We use this really important number called R0, or R0. It's basically how many people, on average, one sick person will infect. For something like the seasonal flu, it's around 1.3. But then you look at measles. Whoa, it's between 12 and 18. That single number is absolutely crucial. It tells us just how aggressively we need to fight back.
All right, with those basics covered, let's jump in our time machine. We're about to see how some of history's biggest crises literally gave us the tools that we still rely on today. Each one of these pandemics was a brutal lesson that forged a brand new, indispensable tool for our public health toolkit.
So here's our roadmap for this little trip. We're going to start way back in the 14th century with the Black Death. That's where we get quarantine. Then we'll zip forward to 1918. The Spanish flu taught us all about what we now call NPIs. And finally, we'll land in the 21st century, where the SARS outbreak proved just how vital global cooperation really is.
Let's start with a number that it's almost impossible to wrap your head around. 25 to 50 million people. That's how many are estimated to have died in Europe alone during the Black Death. It wiped out up to 60% of the entire continent's population. A catastrophe on that scale forced a desperate and, as it turns out, a revolutionary idea. So the plague was spreading through fleas on rats, but it was also spreading from person to person. They had no clue about germ theory, but officials in the port city of Ragazzusa tried something. They made a simple rule. Any ship that arrived had to wait in isolation for 40 days before anyone could step ashore. They called it 40 giorni, which is just Italian for 40 days. And just like that, quarantine, our first major public health tool, was born from pure observation and desperate necessity.
Okay, let's leap forward nearly 600 years to 1918. A new terror hits the globe. The H1N1 influenza virus, better known as the Spanish flu. This thing infected about 500 million people and killed somewhere around 50 million worldwide. That's more than all the soldiers who died in World War I.
You know, what was truly terrifying about the Spanish flu was that it was deadliest for healthy young adults, the people who should have been the strongest. And with no vaccine, cities had to get creative. They started banning public gatherings, they closed schools, they made people wear face masks. These actions, which sound pretty familiar now, we call non-pharmaceutical interventions, or NPIs, and they became the second major tool in our playbook.
Then in 2002, the world faced a new coronavirus, SARS. And this number, 774 deaths, it tells a completely different kind of story. Now, of course, every death is a tragedy, but when you compare that to the millions we were just talking about, this is actually a story of success. SARS was a deadly serious threat that, somehow, we managed to contain. The big question is, how? Well, the answer is in the lessons we learned. SARS showed us the huge danger of super-spreading events, where just one person could infect dozens of others. So what happened? The world came together. We saw incredibly fast, transparent global cooperation and the widespread systematic use of contact tracing. Health workers became detectives, painstakingly tracing every single contact of an infected person to isolate them and break the chains of transmission. This became our third critical tool.
So, let's recap. We've got quarantine from the Black Death, NPIs from the Spanish flu, and global cooperation from SARS. All of these historical lessons, all these hard-won tools, have been organized into a modern step-by-step playbook, the Outbreak Investigation Framework.
This isn't just guesswork. It is a methodical, scientific process. First things first, you confirm the diagnosis in a lab. Is it really what we think it is? Then you create a really strict case definition so that everybody is counting the exact same thing. From there, you become a detective. You describe the epidemiology, who's getting sick, where are they, and when. All that data helps you form a hypothesis about how it's spreading. You test that hypothesis, and only then do you start implementing control measures. It's all about bringing order to an incredibly chaotic situation.
But, who actually runs this playbook? It's not just some document sitting on a shelf. It's a living, breathing system, carried out by dedicated people on the front lines every single day. So let's talk about today's health guardians and see how this whole system actually works.
And this is a really crucial point. During an outbreak, a doctor's job actually splits in two. Their clinical role is what it always is: treat the individual patient sitting in front of them. But they also take on this public health role. They become a key part of the larger response. They're on the front lines of detecting, reporting, and ultimately protecting the entire community.
So how do they even know an outbreak is starting? It's through this amazing early warning system called surveillance. And it's not just one thing. It's tracking symptoms that are reported in emergency rooms. It's labs being required to report certain test results. It's even monitoring news and social media reports for weird health events. Altogether, they create this web that allows for an incredibly rapid response.
Okay, so history has taught us some invaluable lessons, and we've built this incredible system. But the work is never, ever done. New threats are always evolving, which means our preparation has to be constant. So, what does it actually mean to prepare for the next chapter?
Well, modern preparation is a whole bunch of things. It means making sure we have enough personal protective equipment, PPE, and that people actually know how to use it right. It means constantly updating treatment guidelines and stockpiling resources and medicine. And maybe most importantly, it means running regular drills and simulations. Because, let's be honest, a plan that isn't practiced is really just a piece of paper.
I think this quote just nails it. You don't just get prepared and then check a box. True preparedness is a constant state of readiness. It's this ongoing cycle of learning from the past, training for whatever is happening now, and always adapting for whatever is coming next.
And that really brings us to our final question. We've seen how centuries of suffering and incredible scientific leaps have handed us a detailed playbook for fighting infectious diseases. We know what to do. The real question that remains for all of us is, when the next threat shows up, will we be ready to actually use it?